If you or someone you love or someone you know has ever had surgery, you know how stressful that can be. Now, what you don't know is that there's a fine line between success and failure in surgery. Equally so, what you don't know is that there's a fine line between a surgical site infection related to dirty instruments and not. My name is Sean Flynn, and I'm the co-founder of Restore Medical Solutions. And as Greg mentioned, I started my career off 20 years ago in the United States Army. And this jumbled up basket of surgical instruments was the way it was 20 years ago, and it still is today. This is a huge contributor to delay, danger, and demand. And I'll get into that later on. So myself and Ryan looked at over 7,000 surgical procedures in the largest level 1 trauma center in the Southeast, because we wanted to identify what the inefficiencies were in that hospital. And in that 7,000 surgery review, what we found was that that surgical instrument or that basket contributed to many of the danger, delay, and demand issues that are attributed with that surgical basket of instruments. Now, let's talk about the danger. The danger is that surgical needles, contaminated surgical needles, sharp trocars, contaminated blades are still in that jumbled up basket of instruments because of the inefficiency in surgical OR. I personally have been stuck with a contaminated needle, and I was trained to recognize that that contaminated surgical needle was infected. And I can personally tell you that a cold sweat ran down my forehead when I got stuck with that needle, because I didn't know what it was. I didn't know if it was HIV, I didn't know it was hepatitis. The fact that it was unknown was very stressful to me. This is a problem, and I know it's preventable. Now, come 2014, 30 million more patients are going to enter the marketplace. That's just a fact. And the fact that we looked at 7,000 surgical procedures and have the 20 years breadth of experience that myself and Ryan have, we know that we're inefficient right now. So what is a 30,000 or 30 million patients going to do to our healthcare system? That's a problem. Well, myself and Ryan came up with a solution. We engineered our product to be modular. We engineered our product so that upon setup, it saves time from 5 minutes to 2 minutes on the surgical field. We engineered our product to be safer. If you look on the right-hand side, the instruments are open and they're in an upright position. That dirty surgical needle cannot possibly be affixed to that instrument. We engineered our product to go through the mechanical wash process in a cleaner, more effective way. The instruments, again, are open in an upright position. There's more detergent agitation through the box lock and the instrumentation, so you reduce the risk of surgical site infection for the patients related to dirty surgical instruments. And then, of course, we engineered our product to save time. Time in a hospital is very valuable. By incorporating our method in our product, we've actually shown that we could process that same surgical basket in 60 minutes time saving. That's huge. Now there's hard cost savings and there's revenue. Let's look at the hard cost savings. Since we engineered our product to be inside a hard, rigid container, we've eliminated the paper and tape products that are associated with the hospitals. And on an annual basis, hospitals spend about $100,000 just on disposable paper and tape products. We're inside a hard, rigid container, right off the top cut. $200,000 in care and handling issues. That jumbled up basket of instruments contribute to dull instruments. Now, could you imagine being in surgery and that surgeon performing that surgery and having a dull instrument? That's a problem. We've engineered our product, and the hospitals can actually show a direct savings in that. Another $200,000 comes from Sharps-related injuries and the cost associated with that, as well as the overtime reduction. There's a huge expense related to overtime. Could you imagine having to take that jumbled up basket of surgical tools and reassemble it to like items? It takes about 30 minutes to do that. With our process, 5 minutes. That's the hard cost savings, but it gets better. Because through being more efficient at what we do, there are lost billable operating room minutes that are going out the door right now in all of our hospitals. Just one mid-sized hospital using our model and our products can generate revenue of $14.5 million by doing 5 additional cases per day. Now, in my opinion, that's huge. Now, that 30 million more patients that are coming onto the market, we can service that need. So the delay and the demand equates to that, and that's strictly being more efficient at what we do. Now, we do have competition, but they're simply a container which stores surgical instruments inside their container. They're not focused on the efficiency model that Restore Medical Solutions is focusing on. So we have the competitive advantage in that space. How do we go to market? Well, of course, we want to attend trade shows. We want to get in front of the gatekeepers, the key stakeholders, and the people that are actually going to take our technology back to their hospital. Of course, we want to advertise in industry publications, because the people that can't go to their trade shows will actually see our product, see our method, see the results. But more importantly, we want to do hospital demos. Because as you see, if you go out after this intermission, you'll see our product out there. And what matters is you need to put your hands on our product, touch it, feel it, see what it does. That's what we want to do. Now, what are the projections? What is the marketplace? Well, utilizing our model, one mid-sized hospital to totally convert them over to our product and method will ask for 300 trays. At a $1,500 price point, that's $450,000 of opportunity for Restore. Now, mind you, the hard cost savings and the revenue equates to $15 million for the hospital. $450,000 is not a bad price point. And again, there's 6,000 hospitals, 5,000 surgery centers, and this is a $2.2 billion opportunity for Restore. It's a huge marketplace. Now, what has been our progress? 3 months ago, myself and Ryan packed up everything and moved to Memphis. And I can tell you this Memphis community has welcomed us with open arms. We've got key contacts, very good mentors. So we were able to file a non-provisional patent, a continuation in part, and then we've incorporated a method claim in that non-provisional patent, because we're actually changing how reprocessing is done. We've gone through 3 iterations of prototypes, 3 rounds of field testing, because we incorporated what the end user was telling us. And we manufactured our first 20 units. Now, why did we manufacture our first 20 units? Well, we are gearing up, and probably about the second month that we were here, we actually, and I'm proud to announce, that we entered an agreement with Atlanta Medical Center to do a collaborative white paper trial to show a reduction in turnover time. There's a direct correlation between reduction in turnover time and that $14.5 million worth of revenue. We have an agreement, and upon FDA clearance, we will begin our white paper study. We also already announced that in Memphis, St. Francis Hospital will be our first beta test site. Now, this is a Tenet healthcare system. There are 50 hospitals within Tenet. It's a huge opportunity for Restore. It's a white paper trial and a beta test site. We're in 3 of the 50 hospitals already. Now, I'm also proud to announce, as we've been busy, that we have a purchase order contingent upon 510(k) approval and 5 hospital system of 2,500 trays at that $1,500 price point, $3.75 million of opportunity for Restore. Now that's huge. 3 months, lots of hard work, and that it will be the WellStar system. Now what we're asking for is $2.5 million. In August 2012, we're going to submit our 510(k) application and ramp up inventory. You can see in the intermission that we have actually got our last iteration of our prototype. In December of 2012, we're going to conduct our white paper study, contingent upon our FDA approval. And in that 4 weeks, in January, we'll publish that white paper study to include selling our first product into the WellStar Health System. That opportunity is $3.57 million, or $3.75 million. In August of 2013, since we're in 3 of the 50 Tenet healthcare system, we fully expect to be in 10 hospitals within the U.S. That is a $7.5 million opportunity again for Restore. And then in December of 2013, we will apply for our CE mark and try to take this international. Now, I couldn't have done this without a dynamic team. Ryan couldn't have done this without a dynamic team. And they're seated right there. All of our team. Myself and Ryan have over 30 years of experience, both management, clinical, operations experience. Matt Grell has over 15 years of experience in IP and has also raised $150 million in startup capital from which he's been involved in. Ron Hutzel, our engineer, he's been key in taking our product from concept and literally on a napkin to reality with minimal investment in the shortest period of time. Ron Hutzel. Michael Wright, the senior hospital executive who's been key in crafting our message to the senior C-suite executives and getting us that access to show the real value of what Restore is bringing to the market. Trey Heath, marketing, over 10 years of experience in marketing, and I'm proud to announce that just a week ago, he had a baby girl. And Greg Mitchell, who eloquently did the introduction, has over 30 years of business experience and business strategy, and has been key in formulating our strategy to go to market. Now, I talked to you about danger, delay, and demand. Our healthcare system is at a crossroads right now. What I didn't talk to you about is we've had 2 meetings with Medtronic, in particular Rob Varner, the VP of Logistics. And in those 2 meetings, he expressed to us that, I know you guys are focused on hospitals right now, but if you can give us a scalable solution, we'd be highly interested in your product because we see the value in what Restore Medical Solutions is bringing. I say that to say this. We're at that critical crossroad. The time is now to become more efficient. Our patients are demanding more. Our surgeons are being asked to do more with less. The time is now to invest in Restore Medical Solutions. Thank you.